Right now at 5:30, the Omicron variant is now detected in every U.S. state. Health officials warn more people are expected to get infected as they gather ahead of the holidays. Preliminary data out of Britain suggests people with the Omicron variant are between 50% and 70% less likely to need hospitalization than those with the Delta strain. Meanwhile, Israel's panel of coronavirus experts recommends all people 60 and older be given a fourth dose of the COVID-19 vaccine. Thank you for joining us at 5:30. I'm Yolanda Harris. Andrew's off tonight. Well, the big headline here in Ohio again today, a third straight day that we set a new record high for COVID cases. The state health department registering nearly 16,000 cases in the past 24 hours, a nearly 25% jump from Wednesday's record high. So let's get some perspective tonight from Dr. Joseph Gastaldo. He's an infectious diseases specialist at OhioHealth and a member of our team of experts. Dr. Gastaldo, thanks again for joining us.
Yolanda, Merry Christmas. Thanks for having me.
Merry Christmas to you, too. Tell me, Dr. G, what are your thoughts when you see that we've not only set a new record high for the third straight day, but we've experienced such a dramatic jump?
Yeah, so based on our current trajectory, unfortunately, Yolanda, we're going to have more cases in the community compared to last winter. Again, we are now in our second winter with this virus, and we really kind of get back to basics. We have to get back to the basics of how we protect ourselves with masks, paying attention to the crowd you're going to be. But what's different this year is the tools. We have vaccines, we have home testings, and soon we're going to have another tool in the box, 2 different antiviral pills.
That is some good news. What other, than the antiviral pills, that obviously gives us some hope. What gives you hope? It appears we're seeing a repeat of 2021. We're just right back there again. Is there a light at the end of this tunnel anywhere in sight?
Yeah, there is a light in the tunnel. I think once we get through this, when there is a big fire, what you have left after an infection like this, we're going to have more and more people with immunity from vaccines. We vaccinated 200 million Americans. We have immunity from natural infection. And really, we have to get through this. And we still have to be cognizant to protect those most vulnerable. Vaccines are a great layer of protection, but they don't work in all people.
And Dr. Gastaldo, cases, of course, are rising. Christmas is approaching, New Year's, people are getting together. Other than going back to the basics, is there any way to gather safely and not have to cancel your plans? I mean, are washing hands and wearing a mask and being with your family, is that enough to keep it from spreading?
Not in the setting of the Omicron variant. So let's dissect that a little bit. First of all, with COVID, there is no such thing as zero risk. However, we have the tools available. So number one, if you're sick, don't go anywhere, isolate yourself and get tested. Number 2, get vaccinated, get boosted. And if you're going to be indoors with other people, be with other people who are vaccinated and preferably boosted. You should really pay attention to really not getting in large crowds indoors. When you're indoors, pay attention to the ventilation of the air. Another tool that we really need to think about is home testing. Remember, when you get a test done, it's a snapshot in time, but getting testing done right before you gather in a group is an important tool. And again, nothing is zero risk, and please pay attention to those who are immunocompromised where vaccines don't work as well.
Okay, now we just had a story saying that Israel's panel of coronavirus experts is now recommending that people 60 and older be given a fourth dose of the COVID-19 vaccine. Is that the future? They're just going to keep adding on, take another dose, take another dose. Is that where we're headed?
Well, to completely honest, we don't know yet. And again, it may make sense for those older because vaccines don't work as well in those, and those are the ones that we're most likely to protect. But moving forward, if someone is fully vaccinated and then they get COVID and they're home with a cold or a mild flu, that's the vaccine working. I want everybody to have that layer of protection.
All right, let's hope they do. All right, Dr. Joseph Gastaldo with OhioHealth, thanks again for joining us. Once again, giving us your expert advice on all this.
Thank you.